UNC Neuroscience Club decided to create Neuropsychiatric Summit. We started preparing for it in August. Actually, we've been trying to look for our amazing speakers, which was held online all over the world. 3 of our speakers were from USA. Other 2, they were our local great neurosurgeons and our neurologists. And the workshop was also planned, which showcased the scenario of first aid of the seizure. How should you prepare and how should you heal when patients have a seizure like randomly in the street. And another case was suicide prevention workshop, which was done by Dr. Salome and Natia Panjikidze, and they were amazing. They taught us how to do assessment of the suicidal patient, how to do it quick assessment, 30-minute assessment, and so on. All of this was very informative and very necessary for not just medical students in TSMU, but as well as from other universities.
Very happy to be here today because there are a lot of my former students and their interest in psychology I appreciate a lot because of they are medical students, not psychologists. Today we had a workshop to minimize suicide risk, suicide prevention workshop. And participated also Salome Panjikidze, psychotherapist, and actors, and we had some role-play quiz. They are really special students and their passion to their work always fascinates me.
Today we have very good and useful workshop for students, seizure first aid, so what to do and what not to do if we observe the person with seizure. So we discussed how to help patient with generalized or bilateral tonic-clonic seizure, with focal seizures, focal aware or focal seizures with retained awareness, and also how to help patient with syncope. I think we'll provide some skills, we'll explain some skills. Also we have the practice session and students also can practice their skills, and I really hope that this will be very helpful and useful in their future development.
Why it is important? Because not always people know what to do, and sometimes they may even harm patient who is having seizures. And we had SP, so standardized patient. We had different scenarios, and students were much engaged. And I think that after this workshop, they will know how to definitely give good care when somebody has seizures and not to harm this patient. And I think this is very important. Not only students and medical people should know it, but generally whole society must know how to help the first aid. This is very, very important. And many thanks to our students that they did such a great job.
Today our presentation for the abstract was on the topic optogenic stimulation for recovery of the stroke, and we're really happy that we got rewarded for the 2nd place, and we would really like to thank the UNC Summit for giving us an opportunity to do so.
So we are very glad to be part of UNC, and we hope to do more work in it. Thank you.
For me as an educator, that event has great importance. I thought that kind of activities, they meet all the criteria what higher education institutions should meet. First of all, it increases knowledge among students and it's kind of peer education. Secondly, it increases research activities, and awarding ceremony was done greatly here. And this third part, that students see the role of institution and their role also in development of society. So to summarize, today's summit was very interactive and students were very actively involved into all activities, and it was very good also that we had here live scenarios with involvement of standardized patients. So any kind of or any part of the education which we are using in our teaching process was presented here, and I think that students enjoyed, and besides that, the aim of the summit was achieved.
I'm very grateful for my team, first of all, for their hard work. This summit was organized and the idea was born in my head, but definitely was actualized with my amazing team, with the events and coordination and communication. And thank you again for the hard work. Thank you for administration for allowing us to make this happen. And I hope this will be annual, and I will see you in next October.